There was talk of leaky theatres where operations are being performed and a general lack of adequate services in parts of the city today at a meeting hosted by Labour MPs Claire Curran and David Clark. The discussion was led by the Labour spokesperson for health, and she says it's time for the people of the city to have a voice. She wants to see those who've been stopped from speaking out to now be heard.
Well, it is a worry. I mean, we're talking about patient safety, access to services, delays in services, a lack of procedures, nurses worried, midwives worried. You had across-the-board health providers, from those that provide public health wanting to stop things, diseases happening, right through to the orthopaedic surgeon that wants to provide the surgery but can't.
A panel discussion involved speakers from the disability community, a former CEO of the Methodist Mission, an oncologist, an orthopaedic surgeon, and also a mental health advocate. They spoke of a climate of fear arising from people worried about losing their jobs if they speak up, and the concern about the ever-increasing gap between the have and the have-nots. With Otago being such a large area with a wide range of services, one of the problems the panel sees is the issue of the DHB's budget and the pressure to meet targets. A $15 million deficit last year and a $9 million deficit this year means the DHB is required to make cuts. And King says it's those cuts that lead to health inequalities.
Now, we have set out an integrated, comprehensive plan to address health inequalities. It is our number one priority because those who are the hardest hit are the most vulnerable in our society, and they are young, they are old, they are Māori, they are Pacifica, they are people with chronic illness and disability.
Labour MPs want an apology from the Minister of Health for lack of funding in the south and want an assurance that money will be made available for necessary upgrades. The Minister's office was contacted, but no response was forthcoming. D. Karen, 39 Dunedin News.
And Health Minister Tony Ryle responded shortly before we went to air and says the Southern DHB's budget has increased by $107 million in the past 5 years and will continue to increase every year. The Christchurch City